As president of the Santa Clara County Board of Supervisors, it is my privilege to give this year's State of the County with my esteemed colleagues, Vice President Ellenberg, Supervisor Chavez, Supervisor Lee, and Supervisor Simidian. I'm a numbers guy, so when thinking about what to focus on today, my mind naturally went to figures, data, benchmarks, and other measurements. Because numbers tell a story, they tell the story of who we are, what we do, and what we value. In a word, our job is to serve, and we serve a lot of people. As the 6th largest county in California, our organization employs 22,000 individuals in more than 70 agencies and departments. Our work is to provide essential services to a diverse population of almost 2 million people. To put that in perspective, 14 states have fewer than 2 million people living in them. Our ability to serve is heavily impacted by changes in the economy and changes to state and federal policies and funding. The vast majority of the county's $9.2 billion budget uses restricted federal and state pass-through revenues to provide mandated services. For the past 2 years, the pandemic has presented extraordinarily unique and dramatic funding challenges, such as the sobering news we received last week from County Executive Dr. Smith during the mid-year budget review. The staggering cost of the COVID response is a huge problem. Today, the county has spent more than $1.3 billion, and we could surpass $1.5 billion by the end of fiscal year 22, just 4.5 months from now. At the same time, FEMA reimbursements are coming in slower than anticipated. This makes balancing this year's budget tougher than ever, but as always, we will find a way. We will explore options for balancing a budget that keeps the needs of our residents in the forefront. On the positive side, the assessment roll grew 4.6% in 2021. As we know, these tax dollars are what pay for local schools as well as city and county services. But it is not enough for us to simply provide services. This board and all our county employees work every day to promote a safe and healthy community for all. And this work garners national attention and state recognition every year. In 2021, our county was nationally recognized with the Distinguished Budget Presentation Award for Budget Transparency by the National Government Finance Officers Association. And 2 county programs were recipients of CSAC Challenge Awards, the Voluntary Vendor Cost Reduction Initiative and the SSA Voice Videocast. These awards are a testament of our employees' ingenuity and abilities to perform under pressure. And the pressure of the last 2 years has been tremendous and relentless. As the provider of safety net services for our county residents, we see the demands for help have skyrocketed. Homelessness, for instance, for those who are unhoused, it is literally a matter of life and death. And it begs the question, why? Why are there so many unhoused people living in wealthy Silicon Valley? The answer is complicated, but the solution is more straightforward. The solution to homelessness is housing. Housing with case management and supportive wraparound services. People who are unhoused have both short-term and long-term needs, which the county, cities, and nonprofit partners work collectively to meet. The county's Office of Supportive Housing is doing a phenomenal job of working with regional partners to increase the supply of housing. Housing that is affordable and available to extremely low income and special need households. Thanks to the $950 million Measure A affordable housing bond, we are on track to add 4,441 new affordable units to the housing inventory by 2025, enough for 13,000 people. We are now more than 60% of the way towards our 10-year goal in just 4 years. At the same time, we are also investing in the services that are needed to support the newly housed. As the largest public service provider in the region, the county is constantly working to connect people with the life-saving behavioral health services we offer, including mental health, urgent care, emergency psychiatric services, suicide prevention and crisis, mobile crisis response, residential continuum of care, and substance use treatment services for adults and youth. And this is just a short list. Roughly half of the county's budget is dedicated to health services. When someone experiencing a mental health crisis or drug addiction enters a county facility, whether it is a county emergency room or a county park, we connect them with the services they need. The mental health and substance abuse challenges we are facing as a county are equally pervasive throughout our incarcerated populations. This underscores the need to both increase behavioral health services in our jails as well as in our community. These investments will increase the odds of expedited rehabilitation and reduced recidivism. To put it plainly, these investments will help people. Public safety, substance abuse, and behavioral health care needs will continue to be county priorities in 2022, while we continue to provide countless other services such as VMC, fire, ambulance, regional interoperability, assessor, clerk recorder, district attorney, public defender, airports, roads, parks and trails, tax collector, animal services, and the library system, just to name a few. And speaking of animal services and library systems, each has received national honors. In fact, our county library system was voted among the nation's top 5 in the last 60 days. The county has been providing fundamental services for more than 170 years and doing a great job thanks to its employees, even after a deadly virus came to the Valley of Heart's Delight. The first reported case of COVID-19 in our county occurred on January 31st, 2020, more than 2 years ago. Soon after, the virus began to appear far and wide, but spreading even faster was fear and uncertainty, which penetrated deep into the collective consciousness. Many argue that the health, economic, and mental toll of this pandemic will define a generation. Time will tell. But in the face of fear and uncertainty, our county continues to address each new challenge as it comes. The county health system employs more than 9,400 workers who provide services for 900,000 outpatient visits each year, and that was before COVID-19. To meet pandemic demands in clinics, hospitals, call centers, and more, the county invoked a little-known provision of the state constitution, which reads as follows. It is hereby declared that the protection of the health and safety and preservation of the lives and property of the people of the state from the effects of natural, man-made, or war-caused emergencies, which result in conditions of disaster, that all public employees are hereby declared to be disaster service workers, subject to such disaster service activities as may be assigned to them by their superiors or by law. Since March of 2020, more than 4,800 county employees, that's more than 1 in 3 non-health system workers, have been deployed as disaster service workers to support pandemic response efforts. These county employees had to put their careers on hold to join forces with the existing 9,400 health service employees to serve in brand new frontline roles. To put this in perspective, imagine going to work on a Monday as a management analyst. You work on a team with your coworkers to draft and analyze budget documents, all while sitting at a desk in your cubicle. A job you were hired to perform. Now imagine going to work on a Tuesday to discover that you have been activated as a disaster service worker, a DSW. You are then deployed and report to a new supervisor with new coworkers at a new location. Perhaps picking up unhoused people from downtown and driving them to motels or working at a testing or vaccination site. Meanwhile, the county employees who are not deployed are not only performing their own jobs, but they are also asked to do the jobs of their deployed coworkers. In no small terms, our county workforce was asked to step up, and they did, and they continue to do so. For that, everyone is grateful. County residents are grateful. County staff are grateful. Your families are grateful. And we, the County Board of Supervisors, thank you. It is also worth noting that the county's Emergency Operations Center built an entire crisis response almost overnight. Most government planning is carefully orchestrated over the course of months and years, not days and weeks. The scope and scale of the work performed was and still is immense, to say the least. Mass vaccination and mobile sites had to be located, secured, staffed, and publicized. Mobile vaccination units seek out the most vulnerable communities and bring services to them. 1,000 pop-up clinic days have been performed at community centers, schools, churches, long-term care facilities, work sites, and senior centers throughout the county. Outreach is conducted in 5 languages and distributed through a variety of culturally effective means. Door-to-door teams of healthcare workers and promotoras have knocked on 319,000 doors in the highest risk areas in the county. Not 319,000 phone calls or emails sent, but 319 physical attempts to reach people. The same teams have also made 48,000 in-person contacts with businesses. These efforts connect people to information and services, including testing and vaccinations. Since the pandemic started, the county health system has provided more than 1.6 million COVID-19 tests and 1.5 million doses of COVID-19 vaccine. And what is the result? Santa Clara County leads all large counties in the nation, with more than 91% of its residents ages 5 years and older vaccinated, and leads our region in booster shots. This has helped keep our case counts lower than most counties our size and deaths lower than the state average. I want to thank all the county employees who have dedicated themselves to the cause for the past 2 years. Your work is appreciated, and your efforts have saved so many lives. Those who know me know that I'm a cup is half full kind of guy, so I expect to see a return to normalcy in 2022 for our workforce and for our residents. 2022 is my 20th and final year of public service, and I look forward to working with my colleagues on the board, our county staff, and the community as we continue to navigate these uncharted waters and whatever else may come our way. Hall of Fame baseball player and philosopher Yogi Berra said it best when he said, It's tough to make predictions, especially about the future. While none of us can know exactly what the future will bring, I do know that Santa Clara County will take on all challenges head on with grit and determination, with compassion and intelligence. Just a few of the reasons I call Santa Clara County the best there is. Thank you for tuning in, and now let's return to the agenda. Item number 5. Thank you.